Hello, my name is Jody Pelser. I'm the manager of volunteer services at Summerlin Hospital in Las Vegas, Nevada. Today's presentation will focus on how integrating the hospital volunteer into the healthcare team can add value and enhance patient care. The Valley Health System is a network of 5 acute care hospitals that provide care for patients throughout southern Nevada and the surrounding area. The hospitals are accredited by the Joint Commission and offer a comprehensive range of healthcare services. Summerlin Hospital Medical Center is part of the Valley Health System and is a 454-bed acute care hospital located in the Summerlin section of Las Vegas. The hospital offers high-quality medical care in more than 30 specialty areas and employs approximately 1,600 healthcare workers. Hospital admissions reached 22,000 in 2015. Summerlin Hospital Volunteer Services Department is comprised of 235 adult volunteers who contribute in many ways to our facility by providing friendly support to patients and their families. In 2015, the collective group of volunteers devoted nearly 26,000 hours of time to Summerlin Hospital, which is the equivalent of 12.5 FTEs. As an essential member of the healthcare team, volunteers at Summerlin Hospital Medical Center create a strong bond that connects our hospital to the Las Vegas community. They help provide a warm and welcoming atmosphere for our patients and visitors, while they also work with hospital staff by serving as non-clinical caregivers and patient liaisons. Their generous contribution of time and the kind of concern they show is especially comforting to our patients and their families, making a tremendous impact on the patient-focused and family-centered environment the hospital is committed to providing. Guided by the hospital mission and vision, it is the department's goal to increase visibility of the hospital volunteer as well as the level at which they are integrated into the fabric of the institution. The mission of the hospital is to provide exceptional quality patient care and a safe and compassionate environment that provides a positive healing experience for patients and their families. It is the vision to be recognized as a community health leader distinguished by our people, quality, service, and dedication to patients and their families. Our passion is to deliver care in a patient and family-centered manner. Our care will be guided by the principles of respect, dignity, empathy, and emotional well-being of our patients. The mission of Summerlin Hospital Volunteer Department is to provide compassionate, well-trained, resourceful volunteers to complement hospital service by incorporating the hospital's mission and vision. To meet the mission and vision of the hospital and the volunteer department, a plan for increased integration of the hospital volunteer into the healthcare team must be developed. A SWOT analysis of the volunteer department was conducted to determine the best way to pursue achievement of our strategic goal, which included increasing volunteer support throughout the organization to add value to the patient experience. The SWOT analysis revealed a number of strengths. Our team of volunteers are passionate and dedicated to providing our patients with the best care possible within their scope. We have administrative support, and we report directly to the Chief Nursing Officer, which has aided the department in creating a more meaningful partnership with nursing care units. The service of the volunteer department provides is seen as adding value to the patient experience. We have a large, diverse volunteer base. The community surrounding the hospital is very supportive, and many of our volunteers have been part of our team for more than 15 years. While the SWOT analysis revealed our strengths, it also helped us identify our weaknesses. 2 significant weaknesses were identified, one being the clinical staff's limited understanding of how the volunteer can be integrated into the healthcare team and how the volunteer adds value to the patient experience as well as the organization. The second weakness that was identified is the lack of effective communication between the volunteer department and the nursing care units. Although communication channels have opened, this is still a weakness that presents a challenge to the organization as a whole. In order for our strategic plan to be successfully implemented, we will have to focus on education of the clinical staff and interdepartmental communication. In the past, the volunteer department has been an untapped resource for the nursing care units. Communicating the benefits of incorporating the volunteer into the healthcare team to assist in providing non-clinical care will require much diligence. Our opportunities are many. Summerlin Hospital is situated in a growing, affluent community which has been beneficial to the volunteer department. Our community is dedicated to being involved and giving of their time, which has allowed the volunteer department to grow significantly over the past year. The department is well positioned to expand volunteer support in currently serviced areas as well as underserved areas of the hospital. An increase can be made in the number of volunteers assigned to the shift depending on the needs of the clinical care area, and there is an opportunity to increase our networking efforts with the nursing care units. Our identified threats are an absence of a shared vision concerning the role of the hospital volunteer. Although the organization accepts the support of the volunteer department, it does not seem to have a grasp on why individuals volunteer, and the communication challenges have had a negative impact on how successful the volunteer becomes in a given area. Our strategic plan focuses on increasing volunteer support and integration of the volunteer into the healthcare team to add value to the patient's healthcare experience. In turn, improving patient experience scores in the areas of communication and responsiveness. As part of the strategic plan, I conducted a stakeholder analysis which revealed our target customers or stakeholders. The department's target customers are patients and families, clinical and non-clinical staff, hospital administration and leadership, and current and potential volunteers. Through the use of SWOT analysis, an opportunity for increased visibility and integration of the hospital volunteer into the healthcare team was identified. Next, I used our hospital HCAP scores to aid in identifying areas where improvement was needed, and then identified where the volunteer staff could assist in improving the patient's hospital experience. HCAP scores, or Hospital Consumer Assessment and Healthcare Providers and Systems Survey, is the first national standardized publicly reported survey of patients' perspective of their hospital care. The survey asks recently discharged patients about aspects of their hospital experience that they are uniquely suited to address and measures their perceptions of their hospital experience. Analyzing the hospital HCAP scores revealed two areas needed improvement: responsiveness of hospital staff and communication. As you can see in this slide, Summerlin Hospital ranks below the local and national average for responsiveness and communication, leaving significant room for improvement. This weak performance indicates that patients are not receiving the level of service and satisfaction that is needed and deserved. The strategic plan for the volunteer department is to help increase patient satisfaction by acting on our opportunity to expand service into the areas of need, and by focusing on improved communication and education of staff in regards to the integration of the hospital volunteer into the healthcare team. The strategic plan for a volunteer department is to aid in increasing patient satisfaction and comfort by acting on our opportunity to expand service into the areas of need, and by focusing on improved communication and education of staff in regards to the integration of the hospital volunteer into the healthcare team to benefit the patient experience. Patient experience has become a high priority for the organization and is supported by senior leaders, and a call for action was made. Guided by the hospital mission and vision, a strategic plan for the volunteer department was developed. The plan is to increase integration of the hospital volunteer into the nursing care teams over the next 6 months, spanning from March of 2016 to September of 2016. The plan will be carried out in the following manner: change the name of the unit-based volunteer to patient ambassador. Develop a position description that outlines the role and responsibilities of the volunteer. The patient ambassador will serve as a non-clinical support for both the patient, their family, and hospital staff. The patient ambassador may perform such duties as answering patient call-outs and attending to non-medical needs such as delivering linen, personal care items, refreshing water and snacks as directed by the patient's nurse, and providing companionship and diversion by providing reading materials and information regarding hospital services. When the patient has a medical need, the volunteer will notify the clinical staff of the patient need and return to the patient room and inform the patient that the nurse will be with them shortly. The patient ambassador will also help anticipate the needs of the patient by performing patient rounds to assess the non-clinical needs of the patient. Patient ambassador will be identified by a red ID badge for ease of identification by unit staff. The volunteer manager will identify current hospital volunteers interested in patient ambassador program and recruit new volunteers to fill vacancies, allowing for expansion of the volunteer department and the support of underserved areas. The patient ambassador must demonstrate good customer service and act in a professional manner at all times. Qualifications include good communication and interpersonal skills. The ambassador will be assigned to all adult care areas and will be supervised by the department manager and will report directly to the manager of volunteer services. Education materials and presentations will be developed to share at departmental staff meetings, leadership meetings, and will focus on a very specific set of patient ambassador roles and responsibilities and how they can assist patients and families and staff to enhance or improve the patient perception of the care they receive. The volunteer manager will work with nursing care unit directors, managers, and staff to develop professional relationships and coordinate service. Communication will occur via electronic means as well as face-to-face interactions. Department-specific needs will be addressed and assessed in order to provide the highest level of support and to identify the best volunteer for each department. The patient ambassador training materials will be incorporated into volunteer orientation. Patient ambassadors will be assigned to the units with the lowest patient satisfaction scores first. Patient satisfaction scores will be monitored and used as an indicator for successful implementation of the strategic plan. Director, manager, staff, and volunteer feedback will also be considered when assessing the plan. At this time, I will answer any questions you may have. Thank you for listening to this presentation. I hope you gained meaningful information from my presentation today. Thank you and have a wonderful day.